All right, so this is when you would log into the Pieces Connect system. You can see right now I'm logged in as a case manager. So if there was a new person that I wanted to get set up in our system, what I do is add new client. And when you do this, it checks for any duplication of names so that you're not accidentally going through the process with someone that already exists on the system. You're able to make sure that everything is new on here. And this again is just some fake information. So as you can see, because I put a name, there's other people existing, and make sure that I don't mean these other people, but they are not the right person that I'm trying to add here. So I'm going to go ahead and I can continue to add this person to my list. And a really important part of anything, as you all know, working with individuals when we're collecting data or information about them, is to make sure that they are aware that we're collecting the information and that they're willing to give us the information, and they know that we will be sharing it, particularly on an information exchange platform where their information is going to be shared between the parties that are part of the platform. There's various sharing consent levels. So the basic information is very, very basic. It's like name and that's it. There's no date of birth, anything else on there. Personal basic is a little bit more address. This sensitive information, as you can hover over it, you can see that's things like social security numbers, that's health information, physical health, mental health condition, anything like that, that would be very sensitive information there. So if I consent here, and then you can also set that there's either no expiration date for your consent, or if there's specific dates so that you can recheck in and make sure that individuals are comfortable still having their information shared. And when you create your forms, because you can create individualized forms on this system for whatever program you're using, you can kind of tailor those to your needs as well. Create your own consent form and make sure that they're happy with what's being done. So now if I was going to be doing what we call a registration of a patient, again, when you set up your program in here, you can set the eligibility guidelines here. So you can say if there's a certain income level, if there's only certain zip codes that you'd like to serve, and if there's any documents that they need to share for participation in some programs, then you can also have those on there. If there's any restrictions around, the age of population you want to be serving, anything like that. Because this is demo mode, it's all generic. So we continue there. And then you can start to see, so for our program, we provide a separate ID that allows us to keep track of individuals that is separate from their MRN or their social security number or anything like that. So that's their own individual number that we can do that. We can check where they're being screened from. So we would say one, where they're from, Dallas, Texas. And you will see here that as we can register, and this one, as I said before, if there are certain zip codes that you would want to provide, then you can tailor those in there. Say female. And then it will ask, for us, we are interested in Medicaid and Medicare population. They're the ones that are allowed to participate in our program. So, you would choose, choose my ID. And then we could type in that information, which is probably going to match with someone else. And whether they agree, again, so you're checking again to make sure now that you've gathered the information, but do they agree to be screened for these questionnaire or these information? All right. And if you're screening a child, you can also do it for minors. You can add in their information there. And it knows it's not real, so it's and these safeguards are actually quite good, because if you do make an error doing the zip code or anything, it will flag you up and make sure that you're correct. All right. So to show you what it would look like now when someone has been registered on anything, I can pick on one of these individuals that already exists, because we can look for their needs. So we can screen for any type of needs that you want. So for instance, on ours, we have core needs that we screen for and ask about that are part of the CMS AHC program. But there are additional needs that you can look for. You can see on here. So you can ask about employment, you can ask about housing, or whichever ones that you decide that you were interested in learning about. You can see here, this would track any activities that have happened. So for instance, if they met with the counselor, so on and so forth. Encounters, you can see what's been going on with them. Again, this is a demo person, so there hasn't been much, but this is where it gets kind of more fun. So we can do a new referral. So a referral, any of the needs that are flagged up, it will automatically link across here. So as you can see, it links all of the needs that we identified. But if I only wanted to say help with food for today, because the other ones, the individual doesn't feel like they need help with, or they've already had referrals for, you can narrow those down. And you can start seeing on the map, you can see, so from where the individual's location is, so based on their home address that I've put in, it's been registered on the system, you can see that it starts giving you a map, and it'll identify those resources that are around them that are closest. So sometimes we find that things are physically close, but they might have to cross the highway for, or so on. So it's helpful to know where those locations are. So if I wanted to refer, for instance, to this one, it will give you some eligibility requirements if there are any for that program, and it will tell you where it is. So you can add to their referrals, and then you can send it over to them. So this will give that information, that referral will go straight to the organization. So it will go to the OASIS sender for this program. And I can put notes in here. So if, for instance, individual is like vegetarian, or there's things that, they might want to know. You can't put, health information as it says there, but if there are things like only available after 2 p.m., so on and so forth, anything that's going to be helpful for the individual that receives that referral, then that can be included on there. And then you can go ahead and you can make that referral. And when you do this, you can see here the option here. So you can also send a copy of the email to the individual, so they have that for their records. You can print it off for them if you're doing this face-to-face, so they again have that information. And some of the programs now have a text messaging option as well, if people prefer that. So if I don't want to do any of those right now, then that referral will be sent there. And you can see now it's pending on my view that I can see that referral's been made. And when they go there, if the closed loop referral system, they are able to click on that, and then the individual there can put in information in the notes section there as well. So you can see where they've gone and what they've been doing. The other thing that I think is really interesting or helpful with this program is that you can also pull up like reports. So you can see, and it'll give you a dashboard of the activities that your organization has been doing. So you can see there, again, because this is a demo one, it doesn't give all the information here, but you can see how many people have been enrolled, where they've been enrolled. You can see how many people you've encountered and what type of things for. And again, you can tailor this to what you want. So if you want to have a quick at a glance, okay, we've talked to, 700 people this week, 400 of them we made referrals, so on and so forth. It's a really easy way to keep track of your information and be able to have that visualization, that a lot of people, are quite visual learners. So you can see on all those, you can see all the sorts of things on there. And you can download those and keep those records for yourself.